You are watching Easy Medicine, your go-to resource for high-yield concepts made simple. In this video, we will break down two key cardiology cases that you must know for Step 1, focusing on pressure-volume relationships and cardiac tumors. Let's get started. Case 1. In this case, we are going to show the ventricular pressure-volume relationship that affects the therapy of sodium nitroprusside infusion. We have a 45-year-old man who comes to the emergency department due to a 2-day history of dyspnea, orthopnea, and ankle swelling. This morning, he also had nausea, vomiting, and headache. Blood pressure is elevated, and physical examination shows pulmonary crackles and bilateral pitting edema up to the knees. Sodium nitroprusside infusion is begun. The question is, what is the left ventricular pressure-volume relationship that represents the effects of this therapy? The solid line is before nitroprusside, and the dashed line is during nitroprusside infusion. The correct answer is the picture that is shown in the window. The explanation of this case is that this patient most likely has acute heart failure due to systemic hypertension, which can be treated with an infusion of sodium nitroprusside. Sodium nitroprusside is a short-acting agent that causes balanced vasodilation of the veins and arteries. As such, it decreases ventricular preload and afterload, allowing for maintenance of cardiac output. At a lower left ventricular pressure, contractility is essentially unchanged. Of the choices given, only the graph in the image shows a reduction in both left ventricular end diastolic volume, that is preload, and left ventricular systolic pressure, that is afterload, without a decrease in contractility. Case 2. A 30-year-old man is presented to the emergency department due to left-sided weakness. The patient has no known medical conditions but has a 2-month history of positional dyspnea. Vital signs are within normal limits. The strength of the left upper and left lower extremities is reduced, and touch and temperature sensation are similarly diminished. Cardiovascular examination reveals an intermittent murmur at the apex without carotid bruit. Echocardiography shows a mobile 3 cm left atrial mass obstructing the mitral opening during diastole. The patient undergoes histologic examination of the mass. The question is, what are the findings in this histologic examination? The correct answer is amorphous extracellular matrix. This patient's left atrial mass on echocardiography is consistent with an atrial myxoma, the most common primary benign cardiac neoplasm. Approximately 80% originate in the left atrium, and they can present with systemic embolization, such as a stroke, as in this patient, due to tumor fragments passing into the systemic circulation. The tumor may also lead to constitutional symptoms such as fatigue, weight loss, and low-grade fever resulting from cytokine release. In addition, it can cause transient mitral valve obstruction, leading to symptoms that mimic mitral valve stenosis, including dyspnea or hemoptysis. Physical examination often reveals an intermittent or positional mid-diastolic murmur known as a tumor plop, which results from the motion of the tumor mass obstructing the mitral valve orifice. Histopathologic examination of the myxoma reveals amorphous extracellular matrix with scattered stellate or globular myxoma cells within abundant mucopolysaccharide myxoid ground substance containing chondroitin sulfate and hyaluronic acid. Due to their high vascularity, these tumors often demonstrate areas of hemorrhage accompanied by brown hemosiderin-laden macrophages. If you found this helpful, the next part continues with more high-yield cardiology cases, including myocardial infarction complications and critical emergency management. Make sure to watch Part 2 to complete the full review.